All right, welcome everybody. It is Health Talk, and every now and then I get to connect with a dear, dear friend. I won't say old friend because she's not. She's gorgeous. The fabulous Kimberly Roth is joining us. I knew Kimberly when, you're on. I knew you, Kimberly, when you were what I like to affectionately call the queen of the mall.
Yes, yes. And I've not lived that one down yet either.
But anyway, now you are, let me see if I'm going to read this right, because this is very impressive, by the way. She's the resident director of the Merrill Lynch Missoula branch office and the senior vice president of wealth management of Merrill Lynch Roth Eichholz Group.
Yes.
So welcome to the show.
Thank you so much, and it's wonderful to see you too, Peter.
Thank you. And so now you are not necessarily representing Merrill Lynch here today.
No, I'm not.
We're talking about Go Red for Women, right?
That's right.
Okay, so what is this all about?
Well, greatly, with much pride, I'm going to say this is my second year to chair the Go Red for Women through the American Heart Association. And, primarily it's a huge passion of mine, Peter, because it's about educating women and empowering about the real realities of heart disease. And heart disease and stroke is the number one killer of women over and above any types of cancer. 1 in 3 deaths of women are caused by heart disease, which is basically about 1 woman every 60 seconds are passing away from some type of heart disease.
Wow.
And so women's education is probably the most underserved type of education about heart disease. The dynamics and the symptoms are very different than men's. And so actually when I started at the mall, we started the American Heart Walk, and it grew and grew and grew, and we had to move it all over Missoula. And then about 10 years ago, the importance of women and heart disease came to fruition. So we kind of morphed from the American Heart Walk to Go Red for Women.
Okay, so now why Go Red? What's the significance of red?
Well, it's always in the month of February, and it's the American Heart Association. It's their national type of logo, and you see it across the board nationally. We
Sure.
have huge national sponsors for it, and I think Sara can probably elaborate on that a little bit.
Hi, Saras Stout. How are you?
Great. How are you?
Get a little bit closer to the microphone. There you go. So tell me more about this.
The Go Red, it's about our red dress campaign.
Okay.
So you probably have noticed on our logo, we have a very lovely red dress. And it's really just encouraging women to understand and be advocates for themselves when it comes to heart health. So February is Heart Month, and we are the American Heart Association, and that's red.
Okay, so I'm assuming you don't want men to wear the red dresses. I mean, that's
That's totally fine.
Peter, by the way,
Yeah.
is very dashing.
Yeah,
in
we-
his red dress.
Yeah, we
Don't
love
act like he's never put it
we
on.
love people that don't stay within the 9 dots of the box, Peter. So you get out there, hon, and you just advocate for us.
well, you have a lovely red plaid
Yes.
flannel shirt on today. So
'tis the season.
you betcha, you
Right.
betcha.
So I'm curious about the focus on women's heart health. If I'm not mistaken, men die more frequently even than women from heart disease. Is that right or not?
No, John.
No, John.
It's the same.
It's exactly the
It's
same.
exactly the same. That's the misconception that we're trying to break, is that people generally think of older men having heart attacks when they think of heart disease. And heart disease has so many different faces, but especially with women, you see it in all kinds of ages, in types of demographics. But we really want people to understand that women have just as much of a chance of having heart disease as a man does.
Now here, let's talk about heart disease for a minute. For either one of you who wants to answer this question, we have just been absolutely, I don't want to use this word in a negative sense, deluged for the last 10 years or so about cancer. There's this type of cancer and that type of cancer, and there's the Susan G. Komen, and so many different kinds of cancer, the pink and Go Pink and all that. And do you feel that heart disease is kind of not necessarily intentionally, but kind of taken a back seat to the big headline attention that cancer has received?
Personally, what I think is that all of us know, if we think back of family and friends, we're probably aware of people that have both diseases. And if you think of cancer, it has a tendency to be a long, drawn out, emotionally involved. Heart disease is not always that. Mm-hmm. How many people do you know that literally picture perfect health drop down dead of a heart attack.
Right.
Boom, it happens, it's gone. So I think part of it is just the emotional awareness of the fact that it's just not this long experience all the time. I also think it's important that in my situation, I have a lot of heart disease hereditary in my family. And I think that's one of the things that we want to advocate too, is that it's really important for you to understand your parents on both sides of the family, your brothers, your sisters, aunts, uncles, because it's a definite hereditary, as in my case. When Sara talks about, the youth, I had my own little glitch with a heart issue a couple of years ago. And it was pure hereditary. It's one of those signs where we need to educate ourselves. I've been very, athletic and taking care of myself, never smoked, super light drinker, all the things that would, technically define me as a very healthy individual. And, for 1 year, I was like, getting winded, and I couldn't quite jog and jump up the stairs. And I'm just putting it to, I'm just getting old. This is a part of getting older, Kimberly.
That's not true, by the way.
Yeah, but the deal is that by a pure fluke, I went in to have a test done that found out that 2 of my 3 major arteries were almost 100% blocked.
Wow.
And I was in 48 hours later to have 2 heart stents. And theoretically, per the doctors, to be honest with you, if I had not had that done 2.5 years ago, I would not be standing here right now.
Wow.
Doing this interview.
So
when you look at a Kimberly Roth, Peter, you would say, I've known her, I've seen her, physically interactive, emotionally know her, personality know her.
Right.
Would I ever think, would I put her on a heart essence that would have something to be concerned of? No.
Nope.
So you noticed some symptoms before this triggered your hospital visit. One of them was shortness of breath, just feeling tired. It seems like a lot of these symptoms you wouldn't even realize if you were already out of shape and if you were already in a position where you weren't really taking care of yourself. As you've gotten into this deeper, are there more telltale signs that you've been able to pick up on that you can tell people about?
Sara cover that because she's truly educated.
Well, tell you what, we're up against our first break here. And I want to invite our listeners. We have like 26,000 listeners on this show. So if you have a question or you have a comment about heart disease, we have Sara, of course, is representative of the American Heart Association. Kimberly Roth is here to talk about Go Red for Women. If you have a question or comment, give us a call at 721-1290. We would love to hear from you, and we will be right back. Hey, we are back on Health Talk. It's brought to you by Community Medical Center from day one. And today we're welcoming Kimberly Roth and Saras Stout. Go ahead, John.
Yeah, we just had this harrowing story from Kimberly about realizing she was about to die from a heart attack, and then just a few years before you probably would have been dead, you got a stent put in, and it saved your life. But before that, you realized there were some symptoms, and we were just about to speak with Sara, who was going to tell us some of the symptoms of heart disease.
Well, that's kind of the tricky part for heart disease in women. It presents very differently, and a lot of the symptoms are a little sneaky. So it could be shortness of breath. It could be you're feeling dizzy. Generally, people think of heart disease and they're like, oh my gosh, my arm.
Right.
That's usually not the case with women. They have very, very subtle symptoms. So we're trying to advocate for women to, if you just don't feel right, if your body just doesn't feel good, listen to it. Go talk to your doctor. Tell them how you're feeling, because it presents so differently in women, and it's very sneaky. There's no other word.
Now, contrast, if you would, how it appears in men versus women.
Men generally have my arm.
Right. Or they have chest pains.
They have the chest pains.
Right.
Women, it's like it could almost present as an anxiety attack. So you think, oh my gosh, I'm really anxious today, or I'm just not feeling well, or oh my gosh, I suddenly just got really hot. Maybe I'm having a hot flash. You could be having a heart attack.
Oh my goodness.
Which is really different. And that's why we want women to just really pay attention to their bodies and feel comfortable. If you don't feel good, something's off, talk to your doctor.
Do people have heart attacks and not realize that they've had one?
Absolutely, which is really terrifying. People have all kinds of, there's different types of heart attacks, but one of the most scary heart attacks is a STEMI heart attack, and that is one of our most deadly forms of heart attacks. So women who have those sometimes don't even realize that they've had that type of heart attack.
A STEMI?
Don't ask me to define that.
Okay.
Okay.
I'm not Dr. Sara, unfortunately.
All right. Now, I understand when you go in and you have an electrocardiograph or electrocardiogram or whatever they call it, they can actually tell if you've had a heart attack in the past. Is that correct?
That is, yes.
All right. And so that's important to know. So if you go in to get tested, they'll be able to tell you, I don't know if you know this, but was there a time a week or a month ago when you felt such and such and so and so? Well, yes. Well, guess what? This graph says you had a heart attack. So basically, your heart somehow holds that history inside, right?
It holds the damage inside, unfortunately.
Right.
That's the problem, is that you now have some damage to your heart, and that will show up on the EKG.
Wow. Oof.
Wow.
Okay.
So as far as the advocacy goes, what are we telling people to do, or what are we telling people to, as far as being aware of women's heart issues? Do you want them to go exercise? And then I read stories about Olympians that have heart attacks early when they're young and die. So maybe too much exercise is bad. I don't know. I always use that example when I tell my wife.
I'll go for that
people
one.
die when they exercise too much, Ruth. Maybe I shouldn't go out today.
Well, I think there's and I'll give you just a synopsis of myself. A part of the hereditary issue is my father had his first heart attack at 39.
Wow.
Over the course of his life, he had 3 quadruple bypass heart surgeries, and actually at the very young age of 62 had a massive heart attack and passed away. What I have to say is during that course of being with him, the amazing strides in the research of heart research was amazing, because I really believe he lasted till 62 because of the research that the American Heart Association does, because of the phenomenal people that go into the medical industry and want to learn about this and be advocates. So that was a learning thing for me. My misunderstanding when I was young and when my dad was diagnosed was that basically at that time, if you can imagine, in the early 80s was, eat healthy, get exercise, don't smoke, limit alcohol, all the normal things we think of when we think about being healthy. And those are huge components of this. In an era where there's a fast food place on every corner, and a lot of families have, the mom and dad both work, so the time of making good, healthy dinners is limited time-wise, and so we're kind of circumventing different eating issues. Our children are eating differently than we did when we were younger, not quite as healthy. So those are huge components that we need to be aware of. But I'm an example of the fact that even though I knew hereditary issues, I didn't smoke, I exercised my whole life, I ate relatively healthy, very moderate drinker. Because of the hereditary issues, no matter how well I followed all the rules, my body didn't read the book.
Go ahead and have another donut.
Yes, yeah. So my body didn't read all the manuals that it should have, and said, so it went its own way. And so, with the Go Red event that we're having on February 17th of next year, we have phenomenal breakout education sessions. We have live cooking demonstrations about how to...
Tell us when and where that's going to be.
It's going to be February 17th. It's at the Doubletree Hotel. They're a phenomenal partner with us. It's from 10 a.m. to 1:30 p.m. The first couple of hours are educational breakout sessions. We reach out to our community partners, and they put on different venues of events that women and men, we encourage men to come too also. And
there's going to be lots of ladies there, guys.
Do I have to wear a red dress?
No, you don't. But okay. if you want to wear a red tie with hearts or your red sweatshirt, whatever.
Gotcha.
Okay.
I was worried there for a second.
Notice how Peter keeps bringing this up. There's a little girl in there dying to get out.
But all men have a feminine side to them, and so he's dying to wear this red dress. So maybe we'll start out with the red pin. Sarah, what do you think about that?
I was just asking.
Yeah.
Okay, go ahead.
But what we,
protest too much.
It is. It's cute. So we're going to have live cooking demonstrations by the Montana Beef Council.
Cool.
Women's Heart Talk by the International Heart Institute. Healthy Minded Body by Laura Bender Exercise. We're going to have a silent auction. We have phenomenal. They have an opportunity to have their photos taken by Open Lens Pamela. And we have a phenomenal keynote speaker, and his name is Joey Trayrick. He was here last year in 2016. He's coming back in 2017 with whole new topics and things of that nature. But it's amazing. When the women leave, we have about 250 to 300 women attend this event. And we make it very interactive. We make it fun. We make it, because that's the best way to learn, right? Is you have to have some fun and humor, then it sticks in your head. And when they walk out, there's a lot of aha moments. And they become advocates for themselves. And we tell them knowledge is only power if you only go out and use it. So, we're really huge on making sure that we get women up there on the stage that have a story. That's, last year we had 2 different speakers. One's a college student that had major heart issues as a swimmer.
Wow.
And then another individual who had one of the STEMI heart attacks. So, we have, amazing speakers, and it makes you have aha moments because here's this 20-year-old young girl that's had major heart issues since she was 18.
Sure. We're up against a break, and we're going to come back. 721-1290 is our number, and I understand that you're looking for things from people to help with the little babies, right? We're going to talk about that, too, when we come back, and it's all about where Go Red for Women. It's coming up in February, and we'll be right back. And we're back on Talkback, and this gentleman, by the way, will be coming back to Missoula for the 3rd time, by the way, Elton John. Next year. So anyway, 721-1290 is our number, 1-800-568-5309. Go ahead, John.
Well, I know a lot of people are probably listening and are a little freaked out of hearing some of these horror stories. Last year, I had a friend that died suddenly while driving of a heart attack. And it's one of those things that kind of makes you have a life moment. And you're like, wow, that could happen to me. I have 3 kids. What would happen to them? What are some things that people that haven't experienced any of the symptoms we've talked about so far can do to prepare or prevent a heart attack?
You should find a very good heart health program. I believe that there is one at Community Medical Center, and make an appointment. And they run a full diagnostics. That program's phenomenal. I highly recommend it. They have a direct line that you can call.
Right. Yeah,
728-4100
right,
and schedule your appointment.
Right. All right. Now, I also understand that you guys have a very cool program called Little Hats, Big Hearts. So if you could kind of talk about that a little bit, Sarah.
Yes, I'm so excited about this program. So the American Heart Association of Missoula and Community Medical Center, we're partnering together to bring Little Hats, Big Hearts to Montana. This program is across the nation, and this is the first one in the state of Montana. What we want to do is in the month of February, every newborn born at Community Medical Center will receive a little red hat as well as some heart healthy information for new parents to take home. What we want to bring awareness to is that heart defects are the number 1 killer of babies. And that's really scary. That's a very scary thing. But we have fabulous hospitals in Montana, and they perform amazing tests. And so there's a lot of technology and a lot of innovative science around heart defects.
Not only that, but the community has one of the finest NICU units in the Northwest.
Absolutely.
Right.
And so we really want to promote this with the new parents and really help people understand that you can have these tests performed and really the signs and symptoms, but also when you go home as a new family, how to be a healthy new family. And so we are looking for donors in the community who are knitters or crocheters, which is not me. So really any help would be fantastic because this is not a skill I can pick up quickly. We need them to knit or crochet little red baby hats that we'll be giving out to the newborns in February.
Okay, we're running out of time. So real quickly, how do they get those to you?
They could mail them to us at P.O. Box 8951, Missoula, Montana, 59807, or they can drop them off at the Community Welcome Desk at Community Medical Center.
Fantastic. And ladies, thanks for coming. Appreciate it.
Thank
All right.
you.
Kimberly, it's always a pleasure to see you.
Same here,
Don't
Peter.
don't
Thanks.
don't make it another 15 years before I see you again. Okay, for crying out loud. Okay.
Absolutely.
And someone please knit Peter a red hat,
Yeah.
not
I know,
a red
I
dress.
either that or a
red
dress.
hat.
Even a red dress would be even good. Okay, but that's too short.
Make it as long as you can if you got to wear one.
Please. Yeah, you guys have a great day, and we will be back with the 9 o'clock hour of Talkback. Stay with us.